There we go. Well, I want to welcome everybody to the discussion about DAO Excision. Just to start off with, DAO means depressor anguli oris. And so I just want to kind of share some anatomy so that we all are on the same page of what we're talking about here. And there we go. Okay. Barbie, do you see this picture? Does everybody see this picture?
Yep, I sure can. So we
Okay.
can see the face and all the different muscles there.
Perfect.
As the face there, yeah.
Okay. So the DAO muscle is right down here. As I said, it stands for depressor anguli oris. And the purpose of that muscle is to bring you into a grimace. So it turns down the corners of the mouth. And what happens as you are recovering, what we have found is that this muscle here gets shorter and shorter and thicker and thicker. And I'm sure many of you have noticed that when you go inside your mouth and you're poking around, when you get to this corner, you feel that there's tightness and thickness in this area.
Yeah, I sure can. Definitely for me. Absolutely.
Right? Yeah, everybody should stick their finger down into this area and then they can feel that tightness and thickness in there. Well, what happens is when that muscle becomes like an anchor, it makes it much harder for your muscles that pull up to help you with your smile, your zygomaticus muscle and your levator muscle that helps you to show your upper teeth. It even impacts the muscles around the mouth. So for your pucker, because you can see that the depressor anguli inserts into the corner of the mouth. And this area is called the modiolus area. And that's where all of these muscles meet. And so if you have this pulling down here, you get that turn down of the corner of your mouth. And I'm sure many of you, when you're looking at yourselves, you can kind of see that turn down of that corner of the mouth when you compare it to your non-involved side. And one of the reasons that I think this occurs is because gravity is pulling this down. So as you're recovering, the gravity just keeps pulling down and pulling down this lower lip, and your muscles that pull up the upper lip have not returned yet. So this muscle becomes very comfortable in this shortened position.
Yeah, well, mine doesn't go like mine, like if you see it, it kind of pulls up this way, I guess, right?
Right.
Down as gravity, but it's like, yeah, really short.
Correct. Correct. And I'm just trying to, I'm not seeing you, Barbie. I don't know why.
So if you go to the top right, you can put view and you can put side by side speaker, or you can put side by side gallery. Maybe side by side gallery, then you can see me.
I don't know. I don't want to mess this up for everybody.
But in any event,
any event. So this is pulling down, and that area thickens up. And so what I want to go over is what the procedure is and kind of the process that you take when you're considering having this DAO excision. One of the things that the doctors are doing is going and giving you either Botox to this area or what we call the lidocaine challenge. And the lidocaine challenge is a short acting 2-3 hours. They stick lidocaine in here to kind of shut down the muscle from activating so that then you can get corner turn up when this muscle is not pulling down so much.
But that's short term?
It's short term. It only lasts for about 2-3 hours.
Okay.
Yeah. But it's a test before you start putting Botox into it, because if you put Botox into this area, it's sometimes a hit or miss, because that's such a area that's continuous with your depressor labii muscle and then the mentalis, and sometimes the Botox will bleed into that area, so then you lose the ability to pull
Other
down.
things that were
That's correct.
okay before.
Right.
Okay,
Correct.
gotcha.
That's
Okay.
right. So but what they do is they'll do this challenge and see, oh, I like how it looks, I like how it feels. Then they say you're a great candidate for it. Though
Right.
I have had many patients who they were not thrilled with how it looked on the challenge. And my thought about this is, with the lidocaine goes in and numbs the muscle, stops the muscle from activating. The Botox does the same thing. It just lasts for 3 months, but it stops the muscle from activating.
Right.
The problem is, though, I don't think it's the muscle that is overactivating. I think it's that thickness that you
Yeah.
all feel down there, that
Yeah.
thick and fibrotic area that's down there. And so, so by doing the challenge and not necessarily getting great results with my patients, I don't eliminate them from having this excision surgery and thinking they're a good candidate. And in a couple of minutes, I'm going to go over to try to help you determine whether or not you're a good candidate.
Yeah.
But the procedure itself is the DAO muscle is inserted into your jawbone down here, which is called your mandible. And as I said, it inserts in the corner of the mouth at the modiolus. What they do is they go in and basically cut this center part of the muscle. So you no longer have an attachment that connects you from here to here. So this area then has freedom of movement. They also have to cut a little piece of your buccinator muscle, which is under here. The buccinator muscle is responsible for sucking in your cheeks, but you have a lot of buccinator muscle, so that doesn't seem to minimize your ability to suck in your cheeks. But based on the anatomy, they have to go in and cut some of that out. So after they cut that out, they do that from the inside. So there is no external incision. You'll have
no scarring on your face or anything.
No scarring on your face. There'll be a scar inside your mouth that with therapy you're going and you doing self-massage will work its way out and will improve. You'll have some, so I'm gonna stop this share and share another picture here. Okay, so this is one of our patients here, and this is before she had the DAO excision surgery. So I'm sure this picture looks similar to what many of you see when you're in the mirror, that this part of your mouth goes up for a beautiful smile, and then your involved side doesn't, and it stays down here.
Right. Doesn't go up as much.
It doesn't go up as much. And one of the things I want to point out too, because when we get to a couple of other pictures, if you can see that when she goes into the smile, she has some eye synkinesis. You see how the eye is more narrow than on her other side. You can even see too, she has some synkinesis of her platysma, and the platysma inserts right into that DAO area. So when this area, the DAO, is cut, it seems like the platysma also doesn't have an anchor into the face, and so it calms down.
Calms down too, yeah. Her situation, that your patient, looks very similar to mine.
Yes, exactly. And then this is what it would look like immediately post-op. So this is like she got home. The procedure itself takes about 40 minutes. It takes longer to prep you than it is to actually do the procedure.
And you're awake and everything, like it's
You're not, well, it depends who does it. Some of the doctors are just doing a lot of heavy duty numbing as if you were going to have a root canal. And
okay.
others, and it depends on the policy of the hospital. Others are taking you into like an OR situation, and they're giving you like a twilight sleep to put you out. So it
What's a
depends on your
twilight-
doctors.
What's a twilight sleep? Like half
So
a sleep?
yeah, if any of you've had a colonoscopy or an endoscopy, how they kind of just mellow you out. It's not general anesthesia.
Okay.
And it just makes you sleepy, and basically you're not aware of what's going on.
Safe.
It's very safe.
Yeah.
Very
So I
safe.
just, yeah, you're just kind of super drunk. basically.
Yeah, kind of. Kind
Okay.
of.
So yeah.
But
Okay. So you come in, you know, it's not super long day surgery. You're in and out. You're
in and out. You come home and you'll probably look like this, bruised and swollen.
Yeah.
But this is like a day after her procedure.
Okay.
So can you already see how good her smile is?
Yeah.
And so that's a day after her procedure. And then I'm going to share again another screen here. And then this is 3 to 4 weeks after her procedure.
Yeah. Wow. Her eye, I noticed the most.
Do you
is
see,
like
right?
narrow.
Do you see how the eye opens up?
Yeah.
The symmetry of the smile, even it's hard to see in this picture, but you can see that her
Yeah.
platysma
Her
is
neck's
less
calmed down.
involved.
Mhm.
Right. Now, most doctors are not going to promise that this is going to decrease the synkinesis of the eye or the platysma, but in theory, what's happening is if you don't have this drag here of your DAO, then everything will move freer, and they will get it. All these other muscles will get stronger. And
Yeah, 'cause they're being used now. They're not being like pulled down. Like my face when I smile, like I feel like this is pulling this
Right.
way. Right.
Right, exactly. But you won't have that anymore. So then that decreases the synkinesis that occurs, right? As muscles move more independently and as individual units, we have less and less synkinesis. That's the whole
Yeah, well,
point
and
of
they get stronger,
neuro-EM.
like you said, because it's like they wake up where it's like, hey, my turn. Like I get a
Right.
chance now. I'm
Exactly.
back on stage. Yeah. So yeah, okay.
Yeah.
Okay, fantastic. So you guys do it at the center.
We
You
don't do it
right
at the
there? No.
center. No, we have like 6 doctors in the area who do it, but
Mhm.
I am telling you, pretty much every major medical facility that has facial plastics in it is doing it now because it's so easy and the results are really pretty darn good. Now, the question is, let's get back to that idea of the Botox versus the lidocaine in that area. Okay. Say that doesn't work, or you don't even want to go through that. This is a good test, and I want everybody in who's watching to do this.
Mhm.
Is going to pinch here at their lower lip, chin area. Just pinch a little, right, like Barbie's doing. And then I want you to try to go into your smile. And can you see how the turn up of your smile is better
When I'm doing this.
when you're
So like
doing that?
this.
Yeah, so that versus pinch, and you should see that the turn up of your smile
Mhm.
is better,
Mhm. Yeah, a little bit. Yeah.
right?
Yeah. So
So
if a person has that and they pinch their chin and the turn up of the smile is better, then they're most likely a good candidate for this procedure, is what you're saying.
exactly. Same thing, you can pinch it and show your upper teeth and see if that's a little bit easier to do,
Yeah, it feels easier.
right?
Yeah.
So those are good tests to do it. As far as preparing, say you decide you're going to do this. So how do I best prepare for this procedure? Well, one of the things that you can do as you're waiting for your procedure, and again, as a test for the procedure, this is kinesio tape. and the kinesio tape has an elasticity to it. So
Yeah.
the first piece you put down is where the tape pulls back to. So you
Right.
can use, there are boxes on the back of it. You can use 2 boxes. You'd round off your edges. Okay. And then think about this muscle is kind of pulling you down like this. I'm exaggerating right now, but that's what it's doing underneath the skin.
Yeah.
And so we want it to kind of be in this position. So what you would do is you would take the kinesio tape and you would bring it over to your uninvolved side.
Yeah.
Okay. And then you peel the back off. Like so, if it wants to peel off. 1 sec. There we go. So you're going to put it here. You're going to peel it off and you're going to give it a pretty good stretch. And so you can see how that kind of pulled my lips in. Right. And then that would allow you, without you pinching, to go into your smile, your snarl, and
Right, because it's
so-
pulling it, it's giving it a little bit of relief this way, or I don't know.
Exactly. It's like decompressing it. Exactly.
Right, okay.
Exactly right. So this is something that you guys could try and see. Yeah, I like how that feels. Maybe I'll talk to my doctor about doing this.
The procedure.
Doing the procedure.
Now, if people, okay, so people are interested in the procedure, of course, then what's next? Like, I'm in Canada, I know people all over the States. What are we looking at for wait times? What are we looking at for cost? How does,
So yeah, I don't know how it works in Canada, but here insurance is paying for it.
Okay.
And again, it depends on the physicians at your medical center. Our doctors are running about 3 to 6 weeks, depending, to get you in for the procedure.
Now, insurance is paying for it for people with, you have to obviously, I guess, because it's, I don't know.
Yeah, so it's not considered a cosmetic procedure,
Right.
right? It's to improve function of the area. So they've
Okay.
had no trouble getting insurance to reimburse. Even Medicare here in the States is paying for it.
Okay, great. So I wonder if up in Canada, if it's the same thing, because I'm definitely going to look into it. I don't know how that works up here, but you can bet I'm going to look into it and I'll share more about it for sure from the Canada end, because yeah, it definitely does impair usage for a lot of people with paralysis in that
Right.
area, not just a looks thing. So
Now I know in the UK they are not, the doctors there are not like totally on board yet. So they're working on it because the therapists think it would be beneficial. So, every country is a little bit different. The twist that we're doing in our area is actually we're having both DAOs taken out. So you're uninvolved and you're involved. And the reason that is because think about if this is not pulling, right?
Yeah.
And this is pulling so much, you're going to get a little lopsided
Right.
right. So by taking both of them out, then that leaves these muscles here, which is your DLI, and that gives you just a little show of your lower teeth, which is what we need for a good smile, right? You don't need to really show your lower teeth all the way down, but you want to see like the top 1/4 of your teeth, and then go into the smile, and that gives you a beautiful symmetric smile.
Now you're saying taken out. Now you're not actually removing anything, you're just kind of cutting it, right?
Well, you're cutting out the belly of the muscle.
Okay, so you're actually like removing something out,
you're really taking that muscle out. You're making like a square cut in that belly of that muscle, in the belly of that DAO. Do you want that picture again? Would that help?
Yeah, let's look at that again. And while you're
Okay.
pulling that up, Renee is asking, would someone with bilateral Bell's palsy be a good candidate? But I feel like just after you answered that question, then that's a yes, because you would just get it done on both sides.
Correct.
You're saying even if it's not bilateral would be helpful most likely anyway. So there's that question. I see Pierre has joined, which is great. Hi, Pierre. And if you have any questions, if you put them in the chat, it would be great to hear your questions on on the topic for this procedure. I had some people on Facebook asking, like, basically, so if you're in recovery, it's not going to slow down anything else, or how long would a person wait?
So, yeah,
Because-
so oh, hi, Mara, welcome. So if you're in recovery, I would not do this. The only time I would do this is probably wait a good 7 months or so at least. And to me, the reason you would do it is a lot of times patients are complaining, you guys are complaining about, oh, this feels so thick and
Mhm.
tight and I can't stand it. And you're constantly pulling
Yeah,
on
I'm
it and
constantly
pulling
this.
it.
Like I get like pimples here, obviously, because I'm touching it so much. I'm trying to, stretch it out and stuff. So
Exactly. So when they go in, just to show you again, they're making kind of like a window here. And this is
Mhm.
again from the inside. And so
Yeah.
they're taking out this part of the muscle. The muscle that inserts into your jaw, the piece there that stays, and the muscle that's in the corner of the mouth that stays. But you no longer have these two connected, so you don't have that constant pull down of that area.
And is there anything that maybe like in the future that would make these muscles then get lax? Like there's nothing hanging on to them, or?
No, because it just frees everything up. So it will give you a better pull straight at this angle because you're not being pulled down like this.
Right. Right. Yeah.
Right.
Makes sense.
Right. I'm exaggerating that, but in the meantime, let's talk about when you're recovering, right? And you're in those beginning stages of recovery, you're starting to get things back, and you're not a candidate yet for this DAO excision. But we know in patients with slow to recover, they are going to get this tightness. It's just pretty much everybody.
Yeah, like if you don't recover within the 6 to 8 weeks and you're the lucky ones, then you're kind of going to get it at some point. Is kind of what you're saying.
Yeah, well, I would say if you're not fully recovered by 12 weeks, let's use that as a date.
The number,
And if you're not, then that's more likely that you're going to develop this thickness and tightness in that area. But an exercise that I have our patients do when we're going through that, say, initial recovery, you have a little motion, is these are dental rolls. Okay, they're very inexpensive. And I just want you to see, because I do have an asymmetric smile. I will share this with people. I had a stroke many years ago. So I do have, now my asymmetry of my face is different than yours because of the cause, but it's still asymmetric.
yeah.
So when I go into my smile, you can see on this side, I'm not as open as I am on this side.
Right. Yeah.
Right. So with the dental rolls, you're going to take the dental roll and you're going to put it down in this lower lip area. So what you're doing is you're going to give a little assistance to this lower lip to help it pull down just a little bit. Right. So watch what happens to now my smile.
Oh, yeah. Yeah.
You see that?
Yeah.
So this is a very easy exercise for you to do. You put the dental roll in, you work on your smile, you work on your snarl, and that really helps guide that lower lip down. Now we're retraining that area where we're having you work smart instead of work hard. Right. So,
and training it to do the right thing, because I think that's what we need to be careful about. You and I always talk about, there's lots of exercises, videos, and things out there, but you want to make sure you're training the right way.
Correct. And that you're not overtraining.
Not too hard. Yeah, exactly.
Right, not too hard. This is not like the Olympics, right? You can't go 100%. You have to listen to your body. You have to watch how the muscles are recovering, how the nerve is regenerating. You can't force anything to do what it's not ready to do.
Yeah.
So in this case, you're just kind of assisting it and allowing these other muscles to have an easier activity without being pulled down.
Yeah, I think that's great. I mean, also, an easy thing to do. Like you're saying, it's inexpensive. You can just order the stuff off Amazon, I guess.
On
Dental
Amazon.
tools,
It's
you know,
very
it's just
easy.
like you get at the dentist, I guess, right?
And the same thing with the
nothing
kinesio
crazy.
tape. You can get that off of Amazon too. And use the kinesio tape the way I had demonstrated. Now, the stretch that everybody should be doing is you take your thumb. So let's again assume that my left side is my facial palsy side. I would take my right thumb. I would come in right where that thickness is, right where you guys feel that band of thickness. And you're going to put your fingers on either side of that band of thickness.
Yeah.
Right there, usually, okay? And then you're going to stretch that in and down. And it's going to be one of those good pains. It should not give you sharp pain. If it is, you're doing it too hard. But it should feel just like a good stretch in there, right? Does it feel like that, Barbie? Like a good stretch?
Like along here, right?
Right, exactly.
Yeah.
Okay.
Yeah,
So
working
that's a really good stretch for that area. The other good stretch for that area is taking both fingers and just curling down and stretching in and down. In and down.
Yeah,
So bring your fingers a little bit closer to midline, to the middle. There you go. So
Yeah.
I'm right here. Okay. And I like you doing it on both sides so that you can feel the difference between your involved and uninvolved side. And then if you feel it and go, well, it doesn't feel any different, then don't do it, because then you don't need it.
right, because then
so-
they're equal, yeah.
Right. Then you don't need it. The other area, as I showed you, where that DAO inserts into that modialis area here, that also becomes very thick and tight. So a good stretch for that is taking your fingers, stretching out this area, and flipping inside out.
Oh, yeah.
Take the fingers, yep.
Yeah.
Spread the fingers apart and stretch inside out.
Yeah, that feels good, yeah.
Okay. So that's another good stretch for the area. Okay. One other stretch that I want to share with you is, as I showed you and demonstrated in my smile, right? This is smaller than the space I have here, right? So it's tight there. So the stretch you would do is you would pull down here and pull up here. And again, you're going to feel a really good stretch there. You feel that tightness and you feel that stretch.
Yeah.
And my rule of thumb for stretches, ideally, I want you to hold it for 30 seconds and repeat it 3 times. But if at first that's too much, you can hold it for 10 seconds and repeat it 5 times and then work up to the 30 seconds.
Yeah.
What I will say is when you're stretching the corner with those 2 stretches I showed you of the corner, if you're very aggressive, you're actually going to tear the tissue in the corner of your mouth. So I recommend that people use like Vaseline or a chapstick or something like that, so you're not so aggressive.
Yeah, you
And
don't want to make more damage.
you don't want to make more damage.
We don't need more.
Right. Exactly. So, I have never been a big proponent on any of the facial palsy surgeries. I think on some people it's very necessary, but generally I'm not like gung-ho sending my patients into the OR. I will say, and this is why I asked Barbie to talk about this, is because I do think that for those patients who, are past, even if we say past 9 months and the smile is not turning up the way you want, but you really feel the thickness and tightness in there, and that's what's really bothering you, and you go for Botox and it lasts, or you do like the results or you don't like the results. That's why I've been recommending this more and more for my patients. I think it's like, I really, and there's no downside. Like there's nothing bad.
There's
Yeah,
nothing really bad.
There's nothing bad that they can really cut when they do it. It's a very easy procedure from the surgeon's standpoint.
Yeah, you're not cutting any nerves that are going to make it
Oh,
worse
to make you
than any of
worse.
the surgeries that I looked at. I mean, it's been, I mean, a long time for me, like 7, 8 years now. So obviously there's much more information than before, but any surgeries that I kind of looked into was like, oh, well, it could work, it could not work, it could make it worse, it could make it, so, oh, we have some questions here on the chat from Todd.
Okay.
Thank you for hosting. I have synkinesis result of Ramsey Hunt. So 1.5 years ago, and his buccinator is locked. He noticed his test didn't do much for his smile. Surgeon recommended the DAO Excision, but he's looking for your input. Why the best option is proceeding with a DAO Excision versus some other nerve surgeries, selective denervation surgery or selective neurectomy, or even restoration of the buccinator muscle. So can you just maybe talk about comparison to those two?
Yeah, so the buccinator, a piece of the buccinator is going to come out with this DAO Excision. So when you say that the buccinator is locked in, it really, we can unlock it with stretching once this is released. It's just the buccinator again is kind of connected in there. And so you're just taking this piece out that's making it harder for the buccinator, because the buccinator muscle, remember, is taking your tissue and bringing it closer to your teeth, right?
Yeah.
But when it's out here and it's tight and thick, then you can't do that. And then that impacts your smile, it impacts your pucker, and so forth. So we have seen patients, a lot of patients have a tight buccinator. And that is an area that needs extra special attention when you're doing the rehab and doing stretches and getting in there. One of the exercises we have patients do to help with that buccinator cheek area is using a pong ball and putting the pong ball in there. And then that really stretches that out as well. And then as you after you stretch it out, then you can work on assisting the buccinator to work. And again, I like you using both sides like that. So the fact that when you did my test, it didn't quite work, I get that. Sometimes it's more how you're holding it.
Yeah, that's the way too, right?
And so forth. There are other ways of checking. You can just even try putting your thumb here on that thick, tight area. Put your thumb there, and now try going into your smile.
Yeah.
And see if it feels, it's not even, who's this that we're talking to? Is this Todd? So Todd, it's not even that, does my smile look better? It's how does it feel?
Yeah.
Does it feel
clearer.
looser? Right.
Yeah.
Does it feel more like the other side? Because initially, definitely it's not going to look like better, but it's feeling. And my thought process is, if your face feels similar to your uninvolved side, you're going to use it more normally, right? Because when it doesn't feel right, then you start doing these kind of weird things so you can try to make it feel the same. So we're going for that the tissue feels the same, that you don't feel this thickness in the area. Now, as far as addressing about selective denervation and so forth, it's hard for me to specifically say without looking at you, Todd, whether that would be appropriate. Now, people who have very severe synkinesis of the platysma, that selective denervation surgery might be appropriate. The resection of the buccinator, as I said, you're not going to resect out the whole buccinator, but you, in this DAO Excision, you are resecting out a piece of the buccinator. So that should help with that. There are many selective neurectomies that they are doing now. I personally have not been overly impressed with how they look. And this is easy. This is simple, right? If this doesn't work, okay, it didn't work. It does help. I guarantee you it will help this thickness and tightness. But say it doesn't do what you thought
Give
it was.
you the results you thought.
Exactly.
Okay.
Exactly. Then you can always go to one of these more advanced surgeries.
That was,
if
that
the-
was another question. So if you choose to get the DAO done, you can still do the other stuff later. It's not like it's one
Exactly.
or the other. It's kind of like baby step one is what you're saying.
Exactly. Exactly.
Ali says, I was told selective neurectomy could end up making my speech garbled, but that wouldn't happen with the DAO.
Exactly.
Exactly. Like the neurectomy, you're messing with nerves, right? Whereas
Exactly.
you're not, right? Yeah.
Right. And you could then not have as good a tight seal in the corner. We have not been seeing that with this DAO excision. We just haven't.
So anything negative that you've seen?
So I would say the negative is that some patients are disappointed that they're not getting the full turn up.
But nothing's magic, right? So I would
Exactly.
assume you get this procedure, then obviously you have to do the rehab and the physical therapy after, but your results are going to get there faster with the combination of both, as opposed to just the physical therapy, is what you're saying.
Right. I mean, if you're really thick in here and tight, like some of you know, I do a needling technique that goes in and breaks up the fibrosis under ultrasound.
Yeah, I was going to ask you about that if it's similar.
So I have done that many a times on patients with this DAO, and I'm still not getting what I want. It's still so thick in there. And so so by taking it out, it just will feel freer. And that's what everybody says, that it feels freer. And the negative is I still don't have the turn up of my smile that I want. And I will not promise that you're going to get a turn up of your smile that is normal. I will promise it will improve and it will feel better. And that's, so you have to go in with the expectation of, I'm okay if my smile becomes 25% better from this procedure. If you think you're going to get a full normal smile after this procedure, it's not for you. And I don't know really any procedure that really.
I was just going to say, I don't think any procedures like that, any kind of plastic surgery, especially anything that I've had done, you're like, for some reason, I just didn't come out looking like Jennifer Aniston. I don't know why.
I don't know why.
But,
I don't know. You're so close though, Barbie.
So close.
I sometimes I think you're twins.
Sometimes.
So I see Renee asked, what type of doctor do I see for this? I would say you have to go to a facial plastic surgeon. And you ask the question, be very bold when you meet with these surgeons. How many of these have you done?
Yeah,
right?
So we're talking about doctors who do facelifts. That's what you mean when you say facial plastic?
No, you really want doctors who treat facial palsy and are facial plastics. You don't want to go to that cosmetic doctor who's just doing facelifts, because there is a nuance still treating a facial palsy patient. So you want doctors who are familiar with facial palsy, familiar with the recovery, and they're all facial plastic surgeons and ENTs. So they have that double board certification.
Okay, so yeah, facial plastic surgeon, ENT experience with facial palsy, and you want to ask them how many of these procedures they've done, for sure. And especially, for you, Renee, to do it on both sides, would be very helpful, I think. So
if you live in a rural town, Renee, I would look and see what the closest like teaching hospital is. And if you email me at Jodi, Jodi at facialrecovery.com and tell me where you live, I can ask my doctors if they know anybody, because it's a very small network of these doctors, and they all know each other. So I could see if we could find somebody that is experienced with that for you.
So here I am. I don't know if I'm saying that right, but in Florida. Ocala, Florida. I feel like, yeah, so if we email or make a list in some way. But yeah, Hiram, you can email Jody as well and ask for doctors in that area. And then maybe people can share more. Once I get this posted on YouTube, we can maybe post in those comments. I think, Jody, you would have gotten a list of people who joined in on the Zoom, right?
Right.
So we can maybe email after that and send a list of some doctors. I'll send the link of the YouTube. And then as we kind of each find out information about different doctors in our own areas, maybe we can use that as a place to post for people that they might, be able to find someone in their area, because, that's the thing. It's all well and fine, great. And you're like, oh, this is fantastic. I'm in, but now where, where do I
Right.
go?
Well, I will tell you, and I know Mara's on the line, that that people, drive far and fly in to say see Tessa Hadlock at Mass General people have been flying in and driving to see our doctors here and to have it done. I know they go to Dr. Zizadeh out in California to have it done. So, it's not I know there's a cost of coming here, but you would come, maybe stay overnight. I know in Boston, Tessa didn't even really make people stay overnight. And then you go home the next day, and it's not like there aren't stitches that the doctor has
That
to
was the other thing
remove.
there's no recovery. It's not like there's anything internal that you're worried about. They have to keep an eye on. So,
Right.
That's fantastic news as well. So if you are kind of driving in and doing that, maybe, like you're saying, depending on the day or the time that you get for your surgery, maybe you have a hotel night or something, but
Right.
and that's the kind of thing, of course, each personal, people would make for their own personal decisions. And yes, Dr. Azizadeh, is that how I say it?
Azizadeh, right.
Yes,
He does
Jody
perform
does.
the DAO procedure.
Yeah.
He I don't think he performs it in isolation as much as these other doctors. I think he does that as part of other things that he thinks that patients would benefit from.
But
the
he's
other
definitely one that someone could ask questions. Yeah.
Right. And what you need to know, I mean, if your insurance is going to cover it, that's what you want to find too, right?
Yeah, step one. For me in Canada, that's something that or other people, other places in the world, I bet you that would be something that's going to be an out-of-pocket thing. But I'll definitely look into it, because it's something I think, like you were saying, I think it would make a difference for my situation.
I definitely think it would make a difference for your situation. I really do.
So I'll definitely be looking into that.
Yeah.
If anybody has any more questions, they can post them in there right now. But like I said, we will post this to YouTube. Jody will post it on their channel. I'll post it on my channel. And of course, we'll post it on Facebook and everywhere else for people to have this information. And once it gets posted up, please make sure you post any information that you find or any questions. And then that way we can kind of follow up. And, Jody and I have been chatting about doing more kind of talks like this about a specific topic more. And if you are interested in hearing more about those kinds of things, I think that would be really useful. Hey, Jody, for us to be talking about certain things, so people can pop on if they're interested in that, specific kind of topic as opposed to general things. So thank you so much for joining. I think it was great. Yeah, like I said, if there's anything else, what do you think?
There was one new message. Let's see. Oh, I think that's it. Huh.
Yeah, Todd just had one quick question.
Oh, Mara did share that she's going to get us the research on the results of the DAO by Tessa.
Oh, fantastic. Yeah, that's
so, yeah. So thanks, Mara.
That's awesome. And then how long of physical therapy would be required for optimal results for strengthening the other?
So it depends what type of patient you are. If you're really good about doing your stretches and massages, we see patients like 2 to 3 weeks after get you on the program of stretching and massage. And then, depending where you live. Like if you live by us, then you'll see you once a week for 6 visits, just to keep it moving and see how it's going and teach you other exercises. Otherwise we can do telehealth, but the big thing is to be with a facial palsy therapist initially, just so they can show you the proper way to stretch and mobilize that tissue. Because there's one way for me to tell you over telehealth, but until you feel my hands and where my hands are going, or whatever facial palsy specialist that you're going to, it's different. So it would be beneficial to get like at least 3 to 4 visits initially, and then maybe see them again in like 2 months, and and spread it out that way.
Yeah. Okay. Awesome. So we're going to wrap it up for tonight. But Tadeo is asking, is there a physical therapist list anyone can share? Well, maybe he can email into you, Jody, as well. Obviously, as Jody said, they do telehealth appointments there at the Center for Facial Recovery, which I'm finding very beneficial. So obviously better in person, but you can always do that route. Or if you share with her where you are located when you email in, then she can help you out with that. Right. So thank you so much tonight. And we'll be in touch, of course, Jody, as we always are. And thank you to everybody for coming on the call. And we'll post, like I said, on YouTube and do more of these talks in the future.
Sounds great. Thanks,
Thank
Barbie.
you so much. Have a wonderful night.
You too.
Bye,
Bye-bye.
everybody.